I mean, the first thing we have to remember is that mother is responsible for the child's circulation when it's in the womb. And what the mother eats and breathes is translated through these membranes into the growing fetus. So the unborn child is very vulnerable. And we know that toxic chemicals, such as you find in tobacco smoke and ambient outdoor pollution, if they irrigate the child, then you get poor growth in the womb. You get a baby who is smaller for its dates than an otherwise healthy child, and low growth rates in the womb, major hazard for future health. Many of these children can expect to have respiratory problems and maybe other health problems, increased health needs during the early part of their life, for example, during the first year. Now, that's serious enough, but of course, the young infant exposed to a toxic cocktail of pollutants will be at increased risk of inflammatory change in the lungs and other parts of the body. Well, it's a response of the body to an insult. So when you get an insult from a toxic chemical or a virus, the body mobilizes its immune defenses, and these take the form of cells. Cells and chemical transmitters are activated, and they start to mobilize in a way that they present a wall or a defense against the invader. Now, in the case of something like air pollution, that inflammation starts in the lungs, say, but it very quickly translates to the cardiovascular system and then to all the organs throughout the body, including the brain. These pollutants may also access the brain directly through the nerves which pass up your nose and into the central nervous tissue in the brain. It's a silent injury initially, it's a stress, and in somebody who's susceptible, perhaps because they've got poor nutrition, other relatively poor health protection, or they get an intercurrent illness such as an infection, then that might be the tipping point, and they get a potentially serious illness. It certainly stresses and may damage the immune system in a way that it can't cope. So, and that's at the point at which, you know, you might get the development of asthma or chronic bronchitis, acute or chronic bronchitis, or pneumonia. In older people, of course, it may affect the lining of the arteries in a way that leads to a heart attack or a stroke. It may affect the clotting system. These particulates are so fine, and the gas molecules may alter very sensitive proteins like clotting factors and cause disruption of normal physiological processes. So there are many, many ways, some of which we've still got to work out the mechanisms of, but there are many ways in which it may disrupt normal body functioning. So you've got an apparently normal, healthy child who's growing in a highly polluted area. Well, first of all, we have to remind ourselves that every child like that will have a high state of inflammation in their body. So, first of all, the conditions which may lead to chronic health damage are in place. They're actually working, and the extent to which the child will survive that will depend on maybe their genetic makeup, certainly their other lifestyle characteristics, and the intensities of these exposures. But we know from studies here in Hong Kong and elsewhere, for example, some very good recent studies from the US, that children like that don't grow their lungs. They don't grow their lung function in the way that they need to in order to reach maturity at the age, say, of 18 or 19. Because at that time of your life, that's all you get. That's your lung function for the rest of your lifetime. And if those growth rates in lung development are impaired in any way, then you're shortchanged. You start out on your adult life with suboptimal lung function, and that we know. We know that if a child reaches the age of 18 with impaired lung function, that this is going to manifest itself several decades in the future. All we can demonstrate at that point is a problem on a meter. If they blow into a tube and we measure the volume or the flow rates, we can show that they're impaired. The child may feel well otherwise. They're not going to win sprint races, but they may otherwise feel well. But by the time they reach middle life, then many of them are going to encounter bigger problems, and they're going to die sooner than their peers who've made it with better lung function in their late teens. Heart disease, disease of blood vessels like strokes, as well as chronic bronchitis and chronic obstructive lung disease, which is a very disabling condition, are all possible outcomes from these early life exposures to pollutants. We can show that children in more highly polluted areas, first of all, they're flat-footed when they exercise. Their heart-lung system doesn't work as efficiently compared to children living in cleaner air. That has been demonstrated in Hong Kong. Secondly, they're more prone to chronic respiratory symptoms, bronchitic symptoms like cough, phlegm and wheeze. Okay. We can also demonstrate that even if they don't have those symptoms, their lungs are more sensitive to external allergens, so they may develop asthma. The emerging evidence now suggests that that is definitely the case. We have Professor Michael Brower here from British Columbia, from UBC last week, and he was presenting convincing evidence from several studies in different places at different times which support this hypothesis that pollution is actually a cause of asthma as well as an aggravating factor for existing asthma. So two things.
Is it the same in adults?
Yes, late onset asthma in adults appears to be related to pollution. The pollutants like oxides of nitrogen, NO2, actually seem to cause a change in the lining of the lungs in a way which makes them more prone to respond to allergens, which might be from plants and trees like pollen and so on. So yes, there are several mechanisms at work here which may increase the risk of the onset of these diseases, or if you get it for any reason, to aggravate it and make it difficult for you to conduct a normal lifestyle. There's no question that physical exercise is of paramount importance for the development of child health, for the protection of child health, on the one hand. On the other, of course, children have a higher hit from pollutants because their ventilatory rates are higher and they process more polluted air through their lungs, relatively speaking, than adults do. So it's another uncomfortable dilemma. I can only say that I would watch a child carefully, and if there were signs that they were developing chest problems, then I would want to reconsider where and how much they exercised, especially in relation to pollutants. And perhaps the other thing we should say is get away from the roadsides, as far from the roadsides as possible, because at least at one level the risk declines the further you move from the traffic flows. Okay. Of course, some people will want to consider whether they should continue to live and work in this kind of ambient air quality. And I get many phone calls every week from people abroad or here who've got a concern about a child who, let's say, tends to be wheezy, have frequent chest infections, who they know is better when they're out of the territory. And that is very worrying. And the only honest answer I can give them is that you should seriously consider whether you're socially and economically mobile enough to go and live in a cleaner environment. There's no question that if you go and live in Vancouver or Auckland or many other capital cities, you will be relatively much more protected than you are at present in Hong Kong and other Chinese cities.